Assalamu alaikum. This is Mir Ahmer Khan from Minute Mirror, and today we have with us Dr. Syed Ali Raza Sherazi. Thank you very much, sir, for taking time out for this program. He is a consultant orthopedic surgeon at Mayo Hospital, and he's also the senior registrar at King Edward Medical University, Lahore. Plus, he is a medical educationist, researcher, and a medical editor as well. Welcome to the show, sir.
Thank you, sir.
You're welcome. Okay, before we begin, I would just like to ask that there's this myth actually in our country that uric acid is so very closely linked with the consumption of meat, especially the red meat. And since Eid-ul-Adha is so closely related with the consumption of red meat, so let's get a few things discussed and hopefully to get the right answers for the right kind of treatment as well. So my first question is, what is uric acid and why does it increase during Eid-ul-Adha?
Uric acid is actually the normal byproduct of the breakdown of DNA and RNA, purine, which is present in the meat, but it is also increased due to increased use of fructose as well as alcohol. And there is a myth that uric acid is only increased during Eid-ul-Adha, but in Pakistan it is increased during all the festive seasons, Eid-ul-Adha, Ramadan, Eid-ul-Fitr, Christmas and New Year night, because there is increased use of meat as well as sugary products, which are bakery products, as well as alcohol in the non-Muslim population, which is significantly present in Pakistan.
So let me get this straight. So it's not only linked with the consumption of meat and red meat in specific, but also with the consumption of sugary products and alcohol as well.
Exactly, sir. This is the fact which is which is not particularly
associated
with the meat consumption, and the general public doesn't know this particular fact.
Okay, and well, you being related directly with the medical field, of course, you're a surgeon, an orthopedic surgeon. A general idea that persists with the general public is that alcohol is used in a lot of medical, products as well. So can that alcohol have the same kind of effect, with our uric acid, as well?
No, only the drinking alcohol has the effect for increasing the uric acid levels in the human body. Beer is very common in Pakistan because it's cheap and easily available for the non-Muslim population. But the red wine neutralizes or decreases the uric acid levels. Only the hard alcohol and beer increase the uric acid levels.
Okay, and other than alcohol, like which meats and foods cause the highest rise in uric acid?
Sir, actually organ meat, which is very common to be eaten in Lahore and Punjab. For example, the liver and the goat skin, brain, heart, kidneys, these dishes are being called like taka and gurde ka pure in Lahore.
So is this the reason why some people get joint pain right after Eid? Because of consuming all these different kinds of meat, from beef and mutton basically?
Exactly. Not only the joint pain, but suddenly patients get kidney pain also, because the uric acid gets deposits in the form of crystal in the joints as well as in the kidneys. So patients outdoor patient departments are usually very busy after the festive seasons, because there is increased use of purine rich food, and people get the kidney pains and the joint pains.
And sir, how do we really get to know that there are certain foods that are purine rich? That's what you said, right? Purine?
Yes.
So what does purine mean? Could you further elaborate? And which foods do we have to watch out for, who have high levels of purine in them?
Basically, here I will talk about the classes of protein. There is A class, B class and C class protein. A class protein are the chicken and eggs, which have the lowest purine content in them. And the B class protein is the goat meat, which has comparatively higher protein content, and the C class protein is the red meat, cow meat, and the lentils and the legumes. They have high purine content in them. So whenever you consume more red meat and the goat meat and the lamb meat, the purine component increases in the blood, which breakdowns into the uric acid, and after that uric acid gets deposited.
That increases the uric acid inside of us.
Exactly.
Okay, giving us joint pain and muscle pain. Like, other than that, other than the pain, how do we know if uric acid levels are high?
Exactly, this is a very good question to be asked. Usually there is a concept in Pakistan that right after the festive seasons, patient get multiple body aches, and they think that their uric acid are high, and some labs they give the levels, even if levels are a bit high in the labs, patients start taking uric acid medicines themselves. It's called self-medication. People must know that in high level of uric acid, which is hyperuricemia, there is pain of single joint in the body, which is mostly the big toe of the foot or the knee joint. It's always the single joint. It's not the polyarthralgia or the multiple body aches. And along with the pain, there is redness, inflammation, swelling, and the tenderness and the hotness of that particular joint. So some patients get renal colic, kidney pain. So these are usually the symptoms.
Okay, all right. And how soon after Eid can uric acid rise? That's the question to be asked, because Eid-ul-Adha is right around the corner.
Exactly. Uric acid levels rise after 48 to 72 hours. So I basically recommend patients to get their uric acid levels checked after 48 to 72 hours, cause if they will eat some meat and right after they'll go to lab, usually the lab reports come normal.
And is this like only for the elderly, or is this for the younger people as well? Like, I mean, does the uric acid only affect the elderly, or can it affect like younger people as well? Like, what's the age range?
Exactly, it's just like the pandemic. The younger population has a very high uric acid level in Pakistan also, because obesity is very common, insulin resistance is very common, and the uric acid is associated with insulin resistance, high blood pressure, high cholesterol levels, and the young people, they don't drink water much. So it's very common.
Drinking water more and more, it can reduce the inflammation and the uric acids as well?
Exactly.
The levels of uric acid?
Exactly.
Drinking more water?
Yes. Drinking water helps filter the kidneys, more uric acid from the kidneys, so the uric acid levels come down. I usually recommend patients to eat, after eating every meat or protein meal, after 30 minutes, they must drink 2 glasses of water to filter it.
And can uric acid cause permanent joint and kidney pain? I mean, kidney damage?
Yes. Chronic hyperuricemia can cause permanent kidney damage and joint damage. So
sorry to cut you out, but can this effect be reversed somehow with proper medication and regular a workout at the gym and proper nutrition as well? Is there a chance of reversing it totally?
There is chance of reversing hyperuricemia, the high uric acid levels, with diet and exercise and drinking more water, by using lean protein, having more fruits and vegetables in your diet, and having one vegetable only veggie day in the whole week. But if there is permanent damage to kidney due to kidney stones, or the permanent damage to the joints due to uric acid crystals, then there is no way back.
There is no way back. So we should be very, very careful, and I hope that we do consult a professional who could help us in educating us to not go to that level of the uric acids where the damage is permanent. Okay, Dr. Saab, and is beef meat worse than chicken and eggs for uric acid?
Yes, definitely. As I have told you earlier, that the beef protein comes under the category of C class protein, and the chicken and eggs are under the category of A class protein. They are very low in purine content.
And when you say egg, sorry to cut you out, the egg yolks as well? Or just
no,
the egg whites?
Only the egg white.
The egg
only
whites.
the egg white.
What about the yolk? I mean, there is a myth connected with the yolk that the yolk might have the opposite effect. You know, it's not as lean as we might think. So even for the bodybuilders, the yolk is not as good. The consumption should be only focused with the egg whites, on the egg whites.
I will, as an orthopedic surgeon, I will recommend the use of 2 to 3 egg yolks per day for any gym goers or even the general public, because it is very rich in biotin and in multivitamins, and there must be some intake of cholesterol so that the different hormones of the body can be made from it. So you can't avoid the yolk completely, but it's totally insane to eat at least to more than 3 to 4 yolks per day.
Okay, so you mean to say that even the general public, you know, people who do not go to the gym regularly or who do not go to the gym at all, even they can consume 2 to 3 egg yolks per day?
Yes, easily.
Safely. And this will not raise their uric acid at an alarmingly negative level?
Exactly, sir. Exactly.
Okay. Now, does drinking water help lower uric acid, as we discussed earlier, but to the point where you could even take water or replace it or substitute it with a medicine? Like, can water be a medicine in terms of lowering down uric acid?
Yes, sir. Water can be a medicine. I would say that in Pakistan, in winters, there is very low intake of water in the general public. So usually the uric acid levels go high. And in summers, there is a dehydration, as well as there is increased intake of sugary drinks. Which usually increases the uric acid level. I usually recommend general public to drink at least 3 to 4 liter water per day, so that there is a general health as well as there is a low level of uric acid in the body.
And also, when you say sugary drinks, do you mean like the fresh juices as well? They are a part of this, you know, chart of sugary drinks, or are you only talking about the fizzy drinks, like, you know, the like Pepsi, Coca-Cola, 7-Up, and, you know, these fizzy drinks, or, you know, even the sugary drinks of fresh fruits, you know, like sugar cane, watermelon, and all that? I mean, do we have to watch out for these kind of fresh juices as well that have high sugar levels?
Although fresh juices have high fructose level, but the cola drinks or usually the canned juices have highest fructose level. So the people who are fond of drinking these canned drinks or the cola drinks like Pepsi, 7-Up, for all these brands, they usually get high uric acid levels. I have came across some patients who come to me in the clinic, and they say they only eat even less than 20% of the requirement of their of the protein, daily protein. Even their uric acids are high because they are fond of drinking fizzy drinks.
So you mean to say that sugary drinks of the fresh you know, fruits are okay, but the fizzy drinks we have to watch out for?
Exactly, you have to watch out. And during Eid-ul-Adha, what people do, they are eating meat and especially red meat 3 times a day, and to digest it, they are using carbonated drinks also.
Carbonated fizzy drinks, right?
Exactly.
So you mean to say that even if they're sugary, the fresh fruits juices are good for you? They're not harmful?
Exactly, they are less harmful.
Less harmful
for uric acid patients.
Okay. Now, can lemon water or apple vinegar lower uric acid?
Yes, they can lower uric acid, but their effect is only secondary. The main thing is a good diet, good exercise, and the clear water.
So can this lemon water or apple vinegar be a part, or should they be a regular part of your you know, I mean, diet to lower down uric acid, like every day or every other day, once a week? Like, how would that work? if you want to use
the
apple.
detox water, especially lemon detox water, is very good for daily. People with high uric acid level can use it in the breakfast. The apple cider vinegar must be used on alternate days because it causes gastric upset. I have seen multiple shows on the TV and the mainstream media that this thing is, this desi totka is good and that desi totka is good. I would like to educate the general public that only lemon water, but not shikanji bean. Shikanji bean has
Lemonade,
sugar in
right?
it.
Lemonade.
Yes, it has sugar in it. So just use lemon detox water and turmeric water and the apple cider vinegar for it.
And since you've talked about the shikanji bean, that's the the local name for lemonade here in Punjab, especially. What if you use sweeteners like sugar cane or honey, in shikanji bean? Would that be good?
It is less harmful. It's less harmful than the white sugar, but it must be used in a little quantity because there comes the factor of fructose as well. We have to lower down our purine intake and fructose intake as well as alcohol intake.
I think I've heard this word before, fructose. Fructose is present, of course, at a high level in, I think, almost all the fruits.
Exactly.
So should fruits be also cut down in your diet, if you are suffering from high levels of uric acid?
Sir, there are some fruits which are highly beneficial for uric acid patients. They are it's anti-inflammatory diet, berries like strawberry, raspberry, blackberries, blueberries, as well as the citrus fruits. They are very helpful like lemon and the orange. You can use that easily.
And we also know, we also believe and we know that honey is actually a cure for a lot of illnesses and diseases. Can honey be a good substitute to lower down uric acid?
Honey can be a substitute instead of the white sugar.
So
if you are using the honey,
but regardless of the substitution, let's say if you take honey in the morning, with hot or let's say cold water, can that act as a medicine in lowering down your high levels of uric acid?
Sir, actually there is no scientific evidence or researches for that. Only the antioxidant diet helps.
So honey, you mean to say, is not an antioxidant
for uric acid?
For uric acid.
Otherwise, it doesn't help dissolve the.
Otherwise, honey is an antioxidant food.
It is an antioxidant food, but it doesn't help dissolve the uric acid from the blood.
Okay. And is fasting helpful or harmful for uric acid?
Yes, it's a very good question. The fasting or intermittent fasting initially raises the uric acid levels, but later on it lowered down the uric acid level. So actually
the same day or
no, after some days, or after some weeks. So there is a very good medical fact that people get high uric acid levels after fasting or after intermittent fasting, especially during Ramadan. So when they get high uric acid levels, they usually stop the fasting or intermittent fasting, but actually they must continue it to get the long lasting benefits of the fasting, because the long lasting the benefit is the actual lowering of the uric acid level, which is actually very beneficial for the gout patients.
So be it fasting during the Ramadan or intermittent fasting, you mean to say in the long run it's going to help you lower down the uric acid levels?
A lot.
But in the beginning, not?
In the beginning, not.
Okay, all right. And talking about the different varieties of food, what about milk and dairy products and lentils? Do they contribute towards getting the uric acid levels high in your body?
Our uric acid patients stop drinking the milk and the curd. They must not stop drinking the milk and curd. They must only avoid the bakery products. For the uric acid.
And the lentils as well are okay?
And lentils are mostly okay, but they must avoid during Ramadan the dahi bade, samosa chaat, these things. they are harmful.
I think they also have high levels of cholesterol because they're fried. So,
Yes.
but lentils, if cooked at home, would be okay to consume, right?
Yes, if cooked at home. And for the meat, I would like to add that the boiled meat is very good, or the meat with the curry is very good, cause the uric acid and purine levels they are dissolved in the they are dissolved during the that particular food making process. But if we use fried meat, they are not dissolved. They are in the meat.
They remain in the system, right?
Exactly.
Okay.
So we must avoid actually the fried meat, but the boiled meat or the meat with the curry is okay.
Okay, but the curry meat also should not be fried that much.
Exactly.
That's what you're saying.
Exactly.
Okay, and can herbal teas, green tea or coffee reduce uric acid?
Actually, herbal tea and green tea is antioxidant. It helps dissolve the uric acid levels, but coffee actually increases the uric acid level because it causes dehydration in the body.
I'm sorry to say, you said that coffee increases the uric acid.
Yes, coffee
not directly, but because it causes dehydration.
Yes, although coffee is antioxidant, but it causes the dehydration in the body. That's why.
So green teas and herbal teas, they
are very good.
They are
very good, but
they're good for uric acid.
They are good for uric
levels to be
acid,
lowered down.
but the normal tea with the sugar is not good. Cause
Okay.
here comes the
And like we
fact that
discussed
sugar-
earlier, that the sugar can be substituted with honey or sugar cane, brown
Exactly.
sugar as well.
Exactly.
Okay, so and there's one more thing that I've learned, that black coffee is not good for people who have high levels of uric acid.
Yes.
In fact, actually, it raises the levels of uric acid.
Exactly.
Not directly, but because it causes
Because we add
dehydration.
sugar in it.
Okay, and if there's no sugar added in the coffee, still it's going to raise the
Yes, due to
uric acid.
nicotine level and caffeine level in it.
So nicotine by itself raises uric acid
Yes, indirectly.
indirectly because it causes dehydration.
Exactly.
And what if you stay hydrated after consuming coffee, like drinking a lot of water? Would coffee still be a bad agent?
If you drink a lot of water after drinking coffee, that would be very good, because you are making your body hydrated. So
So having coffee and
you
then
can reverse the effect.
having a lot of water afterwards is going to lower down the uric acid
Yes.
levels?
Yes.
Okay. All right. Okay. So good news for the coffee, lovers out there. Okay. What is the best way to detox after Eid meat feasts?
Yes, after Eid meat feast and after all the festive seasons like Eid, Ramadan, Christmas and New Year, people must eat, there must be one only veggie day in the whole week. People must stay well hydrated. They must consume more fibers and fruits and vegetable. They must use vegetable along with meat. There must be a low consumption of organ meat and the red meat, and there must be use of more lean meat and the chicken and the eggs.
But that's to maintain that level of uric acid where it's not reached that alarming level. I'm talking about the detoxing
Yes, if you want
foods
to
and drinks
detox,
how could we easily and very quickly detox our body,
if you
bring
want to
down the
detox your
uric acid
body
level.
or lower down your uric acid level, you must drink a lot of water and you must do at least 30-minute walk. That will lower down the uric acid level. That would help kidneys filter the uric acid out of the body.
So 30 minutes of walk plus the diet that
Lots
you
of
have
water.
spoken about. So this 30 minutes of walk or a workout at the gym would be equally good?
Yes, exactly.
Okay. Okay, Dr. Saab, and should I get my uric acid tested after Eid?
Yes, everyone and even especially the people who eat more meat and the patients with diagnosed hyperuricemia, they must get tested not only after Eid but after every festive season. But the most important fact is that they must get tested after 48 to 72 hours. Because the blood levels of the uric acid are raised after 48 to 72 hours.
So regardless of these festivities, like a person who consumes a lot of meat, red meat, even during the regular days, should get his or her
especially
uric acid
after
tested.
attending wedding.
Okay. So what is the normal uric acid range in men and women?
In men, the normal uric acid range is actually 3.4 to 7 milligram per deciliter, and in women, the normal uric acid levels are 2.4 to 6 milligram per deciliter. But there are some patients who come to me in the clinic who have the acute attack of gout because the uric acid is deposited in the joints or in the kidneys in the form of crystals. Whenever we do the blood labs, they usually come normal because the uric acid has been deposited. It's not in the blood now. So people ask why my uric acid levels are normal. Your uric acid levels are normal because it's deposited in the joints and kidneys now. So, and there also a population whose uric acid levels are high in the blood, but they are not getting any symptoms like joint pains or kidney pains. So here comes the role of the physician to guide them about their levels and the symptoms.
So there's this question that's been bugging me, and that is, can the consumption of dried fruits and nuts raise your uric acid levels at an alarming level as well?
No. Dry fruits are very good. They
all the
don't
dry
increase.
fruits, no matter how oily they are?
The oily dry fruits increase actually the cholesterol levels, and here I must tell you the interesting
and
fact.
I'm sorry to cut you out, but I think there is this misunderstanding amongst us, at least with me, that the higher the cholesterol level, the higher chances of raising your uric acid at an alarming level as well. Is that true?
This is totally true. It's a metabolic disease. It's a metabolic syndrome actually, that the patient get more uric acid levels, hyperuricemia, more cholesterol levels, blood pressure, and insulin sensitivity issues. So whenever you use the fried foods and the dry fruits, there are more chances of getting insulin resistance and the high blood pressure. But the dry fruits, if you talk only about the uric acid level, they don't increase the uric acid level.
Okay. And other than the natural ways, the natural remedies that we've talked about in terms of detoxing the body and lowering down the uric acid, what medicine actually lowers down uric acid?
Here we use three types of medicines. One medicine is used to decrease the overproduction of uric acid in the body. The other type of medicine is used to excrete the uric acid from the blood and kidneys. And the third type of medicine is used to treat the pain and inflammation associated with the hyperuria.
Painkillers?
Yes, it's basically the painkiller, and colchicine is very common. It's over-the-counter drug which usually patients go and buy from the medical stores, but it only reduces the pain and inflammation and the agony associated with gout. It doesn't lower down the uric acid level. For lowering the uric acid level, we usually use probenecid, febuxostate, and the allopurinol, and which is only advised by the physician, not the medical store people, until unless there is a qualified pharmacist, which is mostly available in a good chain pharmacies at Pakistan.
Okay, good. And how do diabetics manage uric acid during Eid?
Diabetics get high uric acid levels during the Eid and festive seasons because using the more fructose rich food increase their uric acid levels. They must avoid sugary foods and sugary drinks, and especially the cola drinks.
Even the natural fresh juices as well that have fructose?
They must be used in a balanced way.
Okay. And can uric acid be controlled without medicine, or medicine should be taken lifelong?
Yes, in 70% cases and patients, uric acid is managed with the diet and exercise. It's not like the diabetes and blood pressure where patient to have to use the lifelong medicines. In 70% patient, it's the conservative management, and the rest of the 30% patients, among them, for some patients we use the intermittent medication with the gaps. and only for some patients we use the lifelong medicines. As per the criteria of American Society of Rheumatology, if there is acute attack of gout more than 2 times a year, and if there is hyperuricemia, more uric acid levels in the body, and if there is any damage or crystal deposition in the joints and in the kidneys, then we use the lifelong medicine for these patients.
Otherwise, workout routines, exercising at the gym are good remedies.
They are very good and natural remedy to lower down your uric acid levels.
And do you recommend any kind of specific exercises for lowering down or maintaining a good level of uric acid?
I would recommend aerobic exercises, which is the treadmill, cycling, and the elliptical for these patients. They should avoid the over-strenuous exercises, but even strength training is very good for them.
So weight training is okay, but
weight training is okay, but it must be low intensity and low frequency.
Okay. And can uric acid patients safely eat meat during Eid?
Yes, they can safely eat meat. They can eat A-class protein, which is chicken and eggs, and the low and limited amount of the goat and lamb meat. Ideally, they should avoid the red meat and the cola drinks, and they should get their uric acid levels checked right after the Eid. And they must hydrate well.
So the beef, cow meat, that should be totally avoided?
It must be avoided along with the organ meat. People avoid beef, but in Pakistan they don't avoid the organ meat during the festive season. They love to eat the taka tak and the gurde ka pure.
So the red meat of lamb and mutton is allowed to some extent, but
in a limited amount.
But cow, beef is completely a no-no?
Actually, it's a complete no-no for the uric acid patient, and for our Sindhi population, where the seafood is very common. The eating the seafood is very common. The prawns are a very rich in purine. People must avoid the seafood also at Karachi.
Okay, so the prawns and
red meat
should be avoided for the people who have high levels of uric acid.
Yes.
Okay, but other types of fish, they're okay?
They are okay.
Okay, so prawns are to be avoided?
Yes.
All right. Okay, Dr. Saab, and talking about the consumption of protein, I'm pretty sure that you are aware of the intake of synthetic artificial protein products as well, like the whey protein. Does whey protein increase uric acid as well?
No, whey protein doesn't increase uric acid level. In fact, I would recommend the patients with the hyperuricemia as well as the athletes to
increase their intake?
To increase the intake of whey protein, so that the uric acid levels are within the normal range.
And I believe that there are 3 categories of whey protein. I think whey protein isolate, whey protein concentrate. So which one do you recommend?
Whey protein isolate is good, but even the whey protein concentrate is equally good. You can use it. And the whey protein is actually the natural product of the milk.
Okay.
We usually concentrate it. The companies concentrate it and they pack it in the jars. So it's okay.
It's natural.
It's natural.
Okay, and also talking about another natural food, that is rice. Can rice raise the uric acid levels in us, or can they lower it down? Different people have different, opinions on the consumption of rice. What's your say on that? For the uric acid patients, we usually recommend the whole wheat products. They must use whole wheat brown rice, like brown rice, and whole wheat bread. Okay. So bread is okay. Rice. Whole wheat bread is okay. Bread is okay, but the rice must be avoided, or they must be taken in a limited amount. White rice or the brown rice? White rice. White rice. But the brown rice are okay. Brown rice is okay, but I would prefer use of more whole wheat. Whole wheat. Okay. And why uric acid is high in gym-goers, as bodybuilders? Because bodybuilders are mostly taking, whey protein, and as you said, that whey protein can lower down the alarming levels of uric acid in you. So why do some bodybuilders have high levels of uric acid in them? The fact is that the bodybuilders and the gym goers have high level of uric acid even in their young age is that they are consuming too much protein per day, and they are using red meat and they are not using lean meat.
as well as they are usually dehydrated. They have more intake of caffeine and the pre-workouts and the creatine, and they do heavy intensity exercises. I've seen people exercising in the gym in the June and July with the hoodies on, and the bodies are very dehydrated. They don't bother the use of ORS or branch chain amino acids.
So you mean to say that the dehydration can cause high levels of uric acid in you?
Exactly.
And when you work out, with high intensity at the gym, with hoodies on, that makes you sweat a lot.
Exactly.
That can raise your uric acid as well.
Uric acid level, and there is also use of
but if you stay hydrated, then it's okay.
Then it's okay. But there is also increased use of anabolic steroids in the bodybuilding in Pakistan.
You also spoke about creatine, right?
Creatine.
How can creatine increase, the uric acid levels? I thought it was good for your muscles.
Creatine is although good for muscles, but there must be more use of water while we are taking the creatine. For the general public, there must be 3 to 4 liters per day use of water, and for creatine intakers, there must be 7 to 8 liter use of water. So creatine actually indirectly dehydrates the body. That's why it increases the.
So it's the dehydration that's the problem.
Dehydration as well,
not the intake of the coffee or the creatine.
Coffee and creatine both indirectly actually increase
because
the
they
uric acid.
cause
They
dehydration.
dehydrate the body.
Okay. And can people with high uric acid still go to the gym if they take off their hoodies, and if they stay hydrated? They can still go to the gym and they can perform high intensity workouts?
They cannot perform high intensity workout, but going to gym is very beneficial for them, especially doing the cardio and doing the aerobics. It usually helps it helps the kidneys to filter the uric acid from the body. It dissolves uric acid from the body. They are usually medicine free. So it's not only beneficial, but it's mandatory for them to go to gym or do the 30 minutes walk in the parks or do jogging.
And also, like the anabolic steroids that you just spoke about, they are being used by professional bodybuilders.
Yes.
Can they, also raise the uric acids, amongst us? And what about the supplements that people take? Because not everybody, uses steroids. But supplements, almost every other person is into, supplements, who's going to the gym. So what kind of supplements do you recommend as well?
As far as the anabolic steroids, they are actually nephrotoxic. They are damaging the kidneys, especially the synthetic testosterone, the trenbolone, the anavar, and the Winstrol. They are most commonly used steroids by the professional bodybuilders. Whenever they use them, the kidneys are unable to excrete the uric acid. So in that way, the uric acid levels are high in the bodybuilders, and when the uric acid levels are high in the bodybuilders, the blood pressure is high, the cholesterol is high, and the insulin sensitivity is less. Okay. So the supplements
you talk about. Do you recommend?
Yes, the pre-workouts in large amounts must be avoided.
Okay, because they have high levels of caffeine,
and they dehydrate the bodies. And the beneficial ones are the antioxidants like vitamin C, vitamin E, vitamin D, and the calcium supplements, and especially the vitamin C is very beneficial for.
And do you think that fat burners as well can play a part in, raising or lowering down your uric acid levels?
Yes, fat burners do the thermogenesis, and they also dehydrate the body a lot, and especially in the females in Pakistan, they use fat burners a lot to cater the obesity issue, and that's why the body is dehydrated and the uric acid levels are high in the females who use fat burners. Okay,
so fat burners should be avoided as well, but if you take them, like Dr. said before, that hydration is the key. If you stay hydrated, then the effects would be minimal.
Exactly.
Right? Okay. And can uric acid weaken muscles as well?
Yes, uric acid weakens muscle. It causes the fatigue and the inflammation. And you know very well that the joint and muscles are the key for the mobility. And if we don't bother about the health of muscles and joint, then there is a lifelong problem, and the life quality is very decreased.
Right. And how can young athletes manage their uric acid levels, and most importantly, and more importantly, I would say the elderly as well, especially on occasions like Eid-ul-Adha?
The young athletes must stay well hydrated. They must eat a lean protein. They must avoid all those supplements which are dehydrating their bodies. They must eat more fruits and vegetables, and they must also do cardio aerobics along with the strength training. I have seen young people in the gym who only do strength training like weight training, and they are afraid of doing the cardio. And they don't know the importance of cardio.
They're hesitant of doing aerobics and cardio,
exactly,
right?
Exactly.
Okay.
And for the elderly, I would advise that they must go to parks for at least 30 minutes in the evening.
And when you say elderly, like what age range is that? Let's be a bit more specific.
In Pakistan, the elderly age range is actually 50 plus, because after 50 the females hormone levels decline, they get menopause, so there is less estrogen level, and in males after 70 there is less testosterone levels, so their bones and joints are weak actually. So advise them the regular
So the
exercise.
men can wait till 70 and
Yes.
the women should not wait till 70 years of age,
Yes.
right? They should be like ready
50.
to go to the park after the age of 50, right?
Exactly.
Okay. Sir, any last note for our audience?
My most important advice for the audience is that they must use lean protein, A-class protein. They must not stop the protein totally. Eggs are good, whey protein is good, chicken is very good. They must stay hydrated. They must use more amount of fruits and vegetables in their diet, and they must avoid dehydration in summer as well as in the winter.
Okay. And since we are so close to Eid-ul-Adha, one more kind of red meat, which is the camel meat, also consumed on this special occasion. I've heard that camel meat can somehow reduce your cholesterol levels and uric acid levels. Is that true?
Camel meat reduces the cholesterol level, but for uric acid level there is no such scientific fact that it lowers it.
But you said that the cholesterol levels are so closely related and linked with the and they're connected with the uric acid levels. So the camel meat may lower down the cholesterol levels,
yes,
but not the uric level,
but not
the uric acid levels. Okay. All right. Thank you very much, Dr. Saab.
Thank you
for your time, and I wish you guys a happy Eid-ul-Adha in advance. Thank you very much. Allah.